Our guest on this episode is a seasoned public health professional who is no stranger to this podcast. She first joined us back in 2019 and returns now to share updates and more of her journey with us today. You're listening to the PHEC podcast, episode 370. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. Whether you're a first-time listener or you're a regular listener of this podcast, I'm really happy that you're here. I lead a public health and epidemiology consulting firm that supports large nonprofit organizations and some government agencies that serve Black, Indigenous, and people of color communities referred to as BIPOC communities. We are often invited to support tribal organizations, and we're always honored and humbled to serve. We help our clients communicate their health data and information in plain language to the communities they serve. Now, this type of support really builds and strengthens relationships between the organizations and the individual community members. Some examples of the support we provide include comprehensive toolkits, fact sheets, custom reports, and community health profiles, as well as data-driven workshop facilitation that engages community leaders on specific disease and health-related topics that are most pressing to that community. If your organization, where you work or lead, serves BIPOC communities or is genuinely interested in building relationships with BIPOC communities, then please reach out to us through our website, which is DrCHHuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization as well. Links to our website will also be provided in the show notes and the description in the app that you're listening to. So on this episode, my guest is Dr. Karen Mancera Cuevas, who was also our guest back in 2019 on episode 108. That's way before the pandemic. A long time ago, right? We will provide a link to that episode in the show notes in case you'd like to listen to that as well. Over the years, Karen and I have kept in touch via social media, email, and even in person a few times at conferences. I'm excited to have her return back to the podcast and share more of her career journey with us on this episode. Let me formally introduce her and then I'll connect our conversation. Dr. Karen Mancera Cuevas is the Senior Director of Health Equity at the National Health Council, where she collaborates with a variety of national patient advocacy organizations on health equity policy, research, and program priorities. She has a professional background, which includes previously working in leadership positions at academic centers emphasizing clinical, public health, and community-based participatory research at the University of Illinois at Chicago and Northwestern University. Additionally, she has engaged with the public in recent statewide government public health efforts in Illinois. Her more than 25 years of professional experience also encompasses varied nonprofit and policy level settings. Programs developed under her leadership address chronic and rare disease health disparities in diverse communities of color, specifically targeting women and children at the community level. She has master's level degrees in public administration and health policy from DePaul University and the University of Illinois at Chicago. Additionally, she's earned a doctorate of public health from Walden University and is a certified health education specialist. Dr. Mancera Cuevas is chair of the Public Health Education and Health Promotion section of the American Public Health Association. She's the chair for the Coalition for National Health Education Organizations. She is associate editor of Progress in Community Health Partnerships and regional committee trustee for the International Union for Health Promotion and Education. Let's connect my conversation with Karen right now. Welcome, Karen, back to the podcast. How are you?
Very good. Very good. Thank you for inviting me, Dr. Huntley.
I'm so excited. Well, we're not going to be all formal on this conversation. You and I go so far back, way before you were Dr. Mancera Cuevas. You were on the podcast, and we've met multiple times in person, and we've just kept in touch over the years. And it's crazy to me to think about how much the time has gone by, how quickly. You were in episode 108 initially. I pulled that up just as we were chatting and getting ready to record. And now this is episode, what did I say, 370?
A lot of episodes have passed, but a lot of time has passed and changes have been brought forth in my career. So excited to be part of the conversation today.
Yes. I am excited to have you here. And yes, there are so many things that has changed in your path. And so let's just start from the beginning, because some people have not been listening to the podcast that long and they may not have heard that episode. So let's start with introduction. Tell everyone a little bit about yourself and what you're doing now.
So currently right now, I'm the Senior Director of Health Equity at the National Health Council, and that's based out of Washington, D.C. And the National Health Council is the leading organization in patient advocacy. So we represent more than 170 organizations that cover the gamut in between the chronic disease, the rare disease space, and everything in between, because we also have associations, we also have industry partners as well. And a lot of that conversation is pivotal because, as we know, our diverse communities are impacted by a variety of disease and conditions. So, for example, I just came off of a call that we did on FDA and the clinical trial guidance, and what does that mean for our diverse communities? And I can bring a lot of space and expertise because I worked 20 years in academia, particularly in clinical trials, particularly engaging diverse communities, having conversations, doing home visiting, and doing the work that's required to engage not only a diverse audience, but also understand the social determinants of health required to understand in order to get them appropriately engaged.
Touching on so many things, I could go down rabbit trails. I mean, especially with this vaccine awareness is coming up. Actually, this month, actually, we're leading a roundtable live to lead that discussion. And we're specifically going to niche down into what that means in BIPOC communities. And so definitely touching on some things that are top of mind. Now, let's roll back the time a little bit and kind of to get a sense of how you got to where you are now. So one of the questions I love to ask, and even back when you were on the podcast before, I did ask this question. Do you remember when you first learned about public health, or maybe first considered public health as a career?
So I might be a unique case because I'm the third generation of my family to do public health. So this is not new for my family whatsoever. My grandfather was a PAHO officer covering huge swaths of Latin America, Central America in the 40s and the 50s. My mother actually specializes in reproductive health, migrant health, and has done a lot of work in that space. And so I'm the third generation of my family within public health to specialize in health education. And a lot of that was due to just engaging in a program where there was a health educator and her just guiding me through the process of what it is to practice the profession. And I was 17, 18 years old at the time. And so when I went, for example, and did my undergrad in community health education at the University of Maryland, I knew from day one that I was going to be a community health educator. I was not going to change my field. I knew exactly what it required, and I was super passionate about it. So the fact of the matter that I've been able to maintain myself within a field and be past mid-career at this point, I think in itself is not only passion, but determination and consistency, and really keeping those threads throughout my career.
Wow. You are a rare gem, because most of us, have this kind of zigzag pattern or discover this, but 3 generations, that's
Three
really impressive.
generations, and being from an Hispanic family, it's like unheard of, right? I mean, there's the issues of, diversity and representation in public health are a challenge. You see someone from, a multi-generational household in the area, and then you also kind of think, okay, like, how does this person pivot and bring a variety of their expertise, right? Because I have anywhere from international experience when I was very small, mentored since I was a 5-year-old on basic epidemiology, speaking to an epidemiologist, to being the person today that sits on several committees as chair, has to represent a diverse population within a patient organization, and speak to a lot of those threads and topics that also need to speak to the nuance of the, commonalities of not only individuals, but also specificities of communities that unless you've really done the work, you don't really understand those particularities.
Yeah, absolutely. Absolutely. I know you stick with a topic, or just by sheer nature of experiencing something through work projects, you can either become more passionate about the same thing, or your passions can kind of shift, or you may pivot on a focus. So I'm curious to know, is there a particular population or public health problem that you are most passionate about now? I don't know if that's the same as before, or if anything's changes, but share as much as you'd like on that.
I would definitely say chronic disease has been really throughout my career, really looking at diabetes, looking at cancer, looking at heart disease, and looking at it in different aspects. Because early in my career, I would do a lot of work, particularly with women, and it might be with epilepsy, but also they had these co-occurring conditions that were more chronic in design, right? So I may be much more inclined to work with diverse populations, with individuals who, are women as well, individuals underrepresented, immigrants, because I'm also an immigrant within the United States, just because I get drawn to that. But I think that at the end of the day, there's a lot of conversation that's still occurring within chronic conditions that, although they are highly prevalent, there are also a lot of issues within populations that there isn't tailored care and there isn't sufficient support. So it really calls to me, like a need for action within the chronic disease space. And then how then do we appropriately not only engage populations, but then the issues of access to care, right? Now I'm representing an organization that is patient driven. But if you look at, for example, navigation, or if you have chronic issues related to chronic disease, it really becomes like a sequelae of events that is really challenging for the individual, particularly when we look at communities that are like necessarily older populations. We sometimes want to function in the present, but we also need to be tailoring to populations that are older to essentially see then how are then we providing supportive care for these individuals. They're living longer, but we don't necessarily have safety net services for these communities as they're continuing to grow. And we need all of these essential elements in order for them to thrive.
Yeah, absolutely. I saw quite a bit of the challenge when it comes down to the older population and chronic disease and access, because we're so in a digital age and so many of them are not, and we keep forgetting that. I saw it a lot during the pandemic at the real early height when the first round of vaccines were being promoted. And to get registered to get your vaccination, you had to be online. You had to log into something. And so many people were not. During that time, I was really focused on a lot of my family members in that category. And I became really quickly reminded of how we're kind of forgetting some of that, and it really limits them, and it creates a bigger gap in that access to care,
It was definitely a challenge, like prior to this role, I was senior director within health promotion in the Illinois Department of Public Health. And so what we did in Illinois, and I think that a lot of that was also state specific, if you had really directors or leaders that wanted to do community-based vaccination, right, wanted to work with community health workers, wanted to engage right at the grassroots level with a lot of leadership coming from the governor's office, that then facilitated a lot of access for older residents. And particularly when we talk about like rural spaces, rural counties, it's very interesting because sometimes people quote unquote rural, like as if like it's something that's a generality. No, it's very much a specificity because geography makes a difference and rurality can be different based on geographic location within the United States. So there are a lot of considerations, right, when it comes to people being able to access. And the COVID pandemic really showed a lot of the shortcomings that can happen. I was approached by individuals who were at home and could not physically get to like a pharmacy. And so literally they had to bring, the COVID vaccine to them and were homebound individuals. So definitely there were state-based solutions, but it really also depended where you were in the United States.
That's true. So you are, one of your shifts and changes since the previous episode is you were in Chicago.
Yes.
But now you're in the DC area, right?
Yes. Now I have relocated with family, pets, and all. We will be marking a year in another week or so for our official arrival into the DC area. And really saw a lot of opportunity, right, and growth. When I was provided this opportunity for leading health equity with the National Health Council, it provides a lot of being able to bring the experience from the grassroots level up to the national level, right? Because I think that the challenge is sometimes, really getting those people who have the professional real world experience to then represent those that then can say, okay, this person generally knows what it is like and has done the work to really be able to have the positionality on these topics because they know the operations, they know the logistics, they know the challenges of the field or the area or the topic. And so I welcome to being part of that conversation because I think particularly in health equity, we really need to appreciate, like those experiences and those professionals that bring that level of expertise.
Yeah. So tell me a bit about a question, like a typical day for you, if there's a typical day or type of project, like the type of work that you're able to dive into and get involved in, and how does that feel?
Well, a lot of that will involve an assortment of meetings. Generally, it will be with the stakeholders or members of our organization or individuals who just want to learn more about health equity and what we're doing in the patient engagement space. We've also built out a lot of affinity groups and support groups for our members so that they're not alone, that they're part of a larger conversation on health equity, as we know that we are entering into potentially perilous political times in which we're talking about health equity, but also the intersecting closer topic of DEI, which in and of themselves are two totally different topics, but for some reason with certain individuals want to be intertwined. So really making sure that health equity, and we consider that, like affordability, accessibility, health literacy is part of the conversation. So a lot of my day generally goes to those types of like meetings, talking to other health equity leaders that lead in the space. I've been so appreciative of meeting experts that truly are passionate about the work with patients and really driving the conversation as we are championing for issues that oftentimes may not have a true linear path, right? Because this is not truly policy, but this is a lot of the intersectional efforts of health equity.
It's encouraging actually to hear that this effort is happening in these important spaces, because often from the negative heaviness we hear, we know the kind of uphill battle it's easy to feel like there's not much focus. We can just stop trying so hard about, with the fight for equity. But it's really refreshing in a sense to hear that this is really very much alive and very top of mind. And there are people and organizations that are really making this a priority.
And that are invested, right? So like early in my career, I worked with like promotoras de salud. Okay, those are the community health workers in Latino communities. And so in order to really be invested in health equity as well, most of us have been doing this our entire career, right? It was just renamed. It was something else. It was not necessarily the labeling of health equity. But we've been doing this essentially our whole like entire career to really talk about disenfranchised communities, talking about diverse communities, talking about the assets too, right? Like we talk about challenges with our BIPOC communities, but also what are the assets? Like we truly have assets. We bring things to the table. We have lived experiences that are unique, and we have to be vocal about that.
Yes. I'm loving that you brought that up too, because that is the focus. And for consulting, those are the clients, the large nonprofits, the government agencies that are serving BIPOC communities. Those are the clients that we solely work with now. And I hear this often, but recently with one of my clients, a tribal organization, it's an intention to bring up those positive aspects. We've been historically loved and supported, not just talking about where we're missing out or where we're lacking, but where we're thriving. And, there is so much that's unique to each culture, and that we need to position ourselves as, the practitioner coming in to learn from the community and look for those wins and look for the different, those nuances that are not just about a gap or disparity or what you're missing or what you're lacking. And that perspective, even that slight shift, can completely change the dynamic of the conversation, the outcome of a program, the engagement with the community. It's those things I get a little wound up about it, but just hearing you talk about this and through your work is really just reassuring.
I think that it's also like the empowerment, right? Because foundationally, I'm a health educator, and health educators really foundationally look at behavior change and the role of behavior change and what are the theoretical models associated with that. But in order to really drive behavior change, you need to really have community investment in order to do that, right? Like sometimes we don't talk about things, the role of like spiritual health, right? For example, that also drive the conversation, the role of mental health that really can influence, like what are roles of peer groups, and not just during youth, right? Like also in adulthood. Sometimes we're always so focused in like the young people, which I do have not so young children anymore, right? They're more in their teens, but they don't think that, adults, even in our mid-career past, continue growing and evolving, right? But we also need to think that targeted communities are also growing and evolving in their own ways, right? Either through their community groups, through their social groups, fraternities and sororities. All of those entities are constantly at play. And then how then does that impact health, I think, is part of the critical conversation.
Ew, I like this. We could go on and on, right? So I'm going to ask you, I guess maybe a little bit of a shift. What I found on the podcast, and we didn't do this before when you were a guest, but I like to connect the dots. I think it's really nice, and especially now that so many people are still asking the question, well, what really is public health, and trying to understand epidemiology and just providing this applied definition, this, especially after hearing this conversation and getting to know you, there are a couple of questions I'd just like to ask you, and it's not looking for this textbook response, but just from your own experience and what does it mean to you type of thing. So the first question is, how does the understanding of public health help you to better serve the clients and community and have a greater impact?
Well, I mean, for me, that's almost like a capstone topic, right? Write a 150-page paper on that. But I think if I were to like put it in a nutshell, I mean, I think like, public health and its intersectionalities has a lot of ending points, and it's not just understanding public health within the confines of a public health department or a public health organization. For me, public health is everywhere at all times, all day, 24/7. When we think about basic things like sanitation, when we think about gun safety, when we think about use or misuse, when it comes to opioid use, it really hits in a lot of different places and spaces. We look at food sanitation, and I really am basic, again, going back to being a health educator, because I think it's important for people to understand that public health is not just when we're in the middle of a pandemic and we're trying to figure out a vaccine. It's like at all times, really. It's making sure that buildings are safe, that you can work in, buildings are safe so you can live in, food is safe so that you can eat it. It just is that elemental. There's like seatbelt laws that one needs to adhere to. And then obviously then you do the next level. There's policies that obviously are derived and that are in place, but that's just more enhanced. But I think that if people like have more of an acceptance that public health is an aspect of their life that has always been there and always exists in real time, I don't think that there will be so much of the concern about the role that public health has. Now, for those of us who love public health, we love it anyway, regardless of what happens. We're here since day one. So, like, we don't have an issue with it. I think that it's increasing the level of awareness of the utility and the expansiveness of what public health really represents in their lives.
That's a really great response. Thank you. Now, I'm going to ask you a similar question, but thinking about epidemiology. So, how does the understanding of epidemiology help you better serve the community and have a greater impact?
So for someone who's a non-epidemiologist, obviously having a firm grasp of incidence and prevalence in a community is really important, because if you're trying to impact, for example, we want to reduce the quantity of diabetes in a community, you pretty much need to know the numbers to just kind of know, okay, this is what I'm impacting. And when I do a DPP program, this is essentially what I would like my outcomes to look like if I'm looking at county or state or city measures, right? So for me, it's more of the basic utility and functionality. I'm not going to necessarily be doing the chi-square or like looking at the two-tailed tests. I did that in both my doctoral and my graduate programs, and won't be looking as much at that granular level. Even some of that is hinging more on biostats and epidemiology itself. But I'm going to be looking at the practical aspects of like, oh, there's so many people who have it. The goal here is to reduce this. And then how can we then go about doing that through health education related programs?
I love that answer. That's really great. And I like it in so many levels, but especially because it's practical and applied, like you said. It's like what you need to take from that to understand it. And that's ultimately my goal for everyone who listens, especially the non-epidemiology people, but just being able to understand this and have this just kind of integrated in whatever it is they do, but that understanding of epidemiology that applies to however you're serving and where you are. So I like that. Okay, so one more question and then I'll be able to let you go. We have a mixture of people that listen to the podcast. We have students, we have up to senior career professionals and all in between. But is there one bit of advice that you could share with someone who may be listening and also interested in similar work that you're doing?
I would say that if like you're truly interested in like health equity or public health or a lot of these related topics, you really have to be persistent in it. And for me, I think like the biggest challenge as I'm moving through my career is I see a lot of individuals in public health start moving into other sectors because they don't necessarily see a good fit or an exact training in the way that they were schooled. And I feel like that's a missed opportunity for the profession. There is a lot of ways that you can pivot your public health equity skill set into many of these work sites and settings that would be so highly valuable. I really feel so sad when I hear colleagues that, all of a sudden are like going from like epidemiology into like marine sciences. Not to say that there's not value there, But obviously a school has invested to train this professional in a field, and we need professionals, right? I think clearly the COVID pandemic proved that we have a shortage of professionals in public health. And what I think we really need to do, and what I counsel a lot of young people, is that you will find your space. It may not be exactly what it is that you want, but you can really utilize that skill set and adapt it to there. And then as you grow professionally and you meet with individuals and other organizations, you can pivot accordingly to just further that. And you can maybe go into other areas of public health. You can do environmental health, right? For example, you could do more policy work if you start in epidemiology or in health education. But my mantra is really to be able to keep people who are trained in public health to do public health, and people who are invested in health equity, that we've been doing this since day one, is to fight the good fight. And we've got to remain here because we are desperately needed.
Yeah, that's a great point. I think that you're right. There's enough variation. We're broad enough as a field that you can find a slightly different iteration of what you do in a different organization, maybe. But like you said, keep them in public health. I think there's a lot of creative ways that we can advance public health. And regardless of, I think people listening to this podcast over the years, if you listen to people, for example, epidemiologists, there's no one size fits all for epidemiologists. I mean, everyone is serving in a slightly different way in a different organization. So there's enough variety. You're right. We need to keep public health professionals in public health. Well, Karen, I am going to make sure that people who are listening are going to have the links to connect with you on the show notes page. But what's the best place, and I'm going to assume LinkedIn, but what's the best place for someone who is listening and wants to connect with you?
Definitely find me on LinkedIn. I'm there, so you can connect to me there. You can connect to me through the National Health Council and through any of the organizations that I belong to, APHA, Public Health Education Health Promotion, the Coalition of National Health Education Organizations. Also, I'm part of a journal, Progress in Community Health Partnerships. So you're going to see me in a lot of different places and spaces. So please reach out and engage with me, and more than willing to have a conversation. I get requests a lot of time from particularly young professionals seeking just an extra ear and advice as to what to do with the next step in their career. So definitely will appreciate having more.
Oh, that sounds great. Well, thank you so much. It's been great to catch up with you. I know that at the time of this recording, we're a couple of months away from the American Public Health Association's annual meeting, and I look forward to seeing you there. It's always fun to get a chance to share a moment with you in person. So that's going to be a lot of fun.
Definitely. And please come to our sessions.
Yes. Thank you, Karen, so much. I really appreciate you taking time to join me and catch up on this episode and to generously share with everyone here as well.
Okay, thank you.
I really hope you enjoyed that conversation as much as we did. Karen is an experienced public health professional with a true passion for equity. I encourage you to connect with her and learn more about the work that she's doing. You can find the links to connect by visiting the show notes, which is episode 370. It can be found by going to phecpodcast.com. Once you're there, just navigate to episode 370 to find the show notes. One more thing before you go. Please take a moment and share this episode with a friend. I'm sure you know at least one person at least, who would be interested in hearing this conversation, the conversation that Karen and I just had on this episode. If you're listening now in one of the podcast apps, then you can easily share through a text or easily share directly to social media. At the bottom of the show notes page, you'll also find social media sharing buttons, which make it really easy for you to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.